You may know that tiredness, lack of motivation and changes in weight or sleeping patterns are some symptoms of depression. But do you know that there are more than one type of depression? The most common form is major depressive disorder. There are also seasonal affective disorder, postpartum depression and dysthymia, which is a long-term form of depression that lasts for years. This video presents Persistent Depressive Disorder. All you need to know. We have other videos for seasonal affective disorder and postpartum depression, so check them out. What is persistent depressive disorder? Suffering from persistent depressive disorder, dysthymia, the most common feeling is sad, but it's more than that. Dysthymia is a less severe form of chronic depression, causing the patients to be less interested in normal daily activities, have low self-esteem and feelings of inadequacy, feelings of despair and difficulty with productivity. Moreover, this kind of mental health problem also results in some negative effects on social life, especially social relationships at school, at work or even with family. Causes of persistent depressive disorder. There has not been an exact and official announcement about the cause of dysthymia. But as one of the types of depressive disorder, dysthymia may be a problem of the following. Personality traits, such as low self-esteem, pessimistic, self-critical. History of other mental disorders. Brain chemistry. Some parts of the brain have connected with dysthymia. Environmental life events. Loss of a parent during childhood, traumatic events such as loss, financial problems, and high levels of stress can trigger dysthymia. Genetics. People with a parent diagnosed with dysthymia are more likely to have the disease. Symptoms of persistent depressive disorder. Feeling depressed most of the time is the typical feature of dysthymia. For adults it may last 2 years or 1 year for children and adolescents. Symptoms of dysthymia can come and go over time with different intensity, but generally, they do not go away for more than 2 months at a time. Following are some symptoms. Poor appetite or overeating. Insomnia or hypersomnia. And no mood for doing daily activities. Having difficulty concentrating and making decisions. Low energy or fatigue. Social isolation. Throwing tantrum. Feeling sad and down, sometimes feeling guilty for no reason. Low productivity. Low self-esteem, self-criticism, or feeling incapable. In children, they are often irritable and fall into a depressed state. Treatment for persistent depressive disorder. As a chronic disease, dysthymia symptoms are sometimes mistaken for a part of life. You should seek immediate treatment if suffering from the symptoms we mentioned above. First of all, we need to identify exactly the underlying cause of the disease. By making a list of symptoms over a few weeks, the doctor will gain a better understanding of how the symptoms are affecting your daily life. Medication and psychotherapy are highly recommended for dysthymia treatments. The method of treatment, as well as the treatment plan, will be decided by the doctor, depending on your preferences, the severity of your symptoms, drug tolerance and the previous mental health treatment. For children and adolescents, psychotherapy is the first recommendation. Medications. The most common antidepressants to treat dystonia include TCAs, tricyclic antidepressants, NRI, serotonin and norepinephrine reuptake inhibitors, SSRI, selective serotonin reuptake inhibitors. Each of the above medicines carries side effects, therefore, patients should consult with a qualified doctor to prevent potential harm. Besides, the doctor will give you the right medication with a reasonable dose to effectively control the problem. Do not stop taking medications on your own or change medications without your doctor's instructions. Psychotherapy for persistent depressive disorder. Psychotherapy involves discussing your symptoms and how they impact your life with a mental health provider. Here are some benefits of this method. Controlling crisis and symptoms. Identifying the causes of dysthymia and planning to eliminate them gradually. Identifying negative beliefs and replacing them with positive ones. Providing adaptive problem-solving skills. Improving self-esteem. Learning to set and achieve personal goals. Exploring ways to build positive relationships with others. Psychotherapy is diverse, and sometimes patients need to combine a variety of treatments. Consult your mental health provider about the choices below. Process-oriented talk therapy. Family therapy. Group therapy. Cognitive behavioral therapy, CBT. Lifestyle changes. A healthy lifestyle always plays an important part of the treatment plan for dysthymia, including daily exercise, nutrition, assistance with life skills as necessary, healthy sleep patterns. Although there is no cure for depression disorders, people with dysthymia can still control it for happy and healthy lives. Symptoms can be reduced if they are provided with a solid support system, together with expert advice. Have you ever experienced dysthymia, or do you know any cases of this condition? Tell us in the comments section below. Thanks for watching.